My name is Caroline Gwendon, and I am a student at Indiana State in their Doctorate of Athletic Training program. Today, I'm going to talk about the disablement model and how it relates to injury prevention as well as injury risk factors. To start with, I'm going to talk about the disablement model. And throughout this presentation, I'm going to use the example of the injury of patellar tendonitis. So the disablement model is broken down into 5 different categories, and the first is origin. So origin is when the pathology occurs at the cellular level. In patellar tendonitis, this would be inflammation occurring around the patellar tendon. Next, at the organ level, the injury has progressed and caused decreased function in the organ. And again, my example of patellar tendonitis, this would be seen with decreased strength in knee flexion and extension. Moving on to the person level, this is where the injury starts to impact their activity. So if this is a basketball player with patellar tendonitis, and he might begin to see a change in his jumping ability or an increase in pain while jumping or landing. Moving on to societal, this is when the individual sees a change in their roles, and this may or may not impact others. With this example, if my patient is having an increased amount of pain and isn't able to complete a game, or we have to modify his practices based on his symptoms, then we are changing his playtime. Next is the environmental level, and this is where we see social limitations. If my patient is on family vacation and they decide that they are going to go hiking for an activity, my patient, if he has enough pain, may not want to do that activity. So his injury is inhibiting his social interactions with his family because he is modifying what he does. Next, I'm going to discuss some injury risk factors, and these are broken down into 2 categories. There's modifiable and non-modifiable. Obviously, modifiable risk factors can be changed, and some wide categories of those would be environmental, anatomical, neuromuscular, and hormonal. And in my example, environmental factor may be the playing surface. If he is practicing on a concrete court at home, that might be influencing his symptoms, so we can remove him from that situation. Anatomical would be flexibility. We can work on increasing his flexibility to decrease his symptoms. And again, with amount of activity, we can change his activity and switch some exercises in and out to help decrease the symptoms he's experiencing. Moving on to non-modifiable, again, there are environmental, anatomical, neuromuscular, hormonal, and demographic. In my example, this would include the playing situation, patella positioning, growth, and sex. Obviously, I can't remove jumping completely from basketball because it's just part of the sport. Moving on to injury prevention. This is broken down into primary, secondary, and tertiary prevention. In primary prevention, this is when healthy individuals take up activities to avoid the onset of a pathological process. Health, promotion, diet, exercise, and vaccination. In my example, I can screen for poor techniques and work on correcting those. I could also have my patients perform a strengthening routine and also have a gradual introduction to activity. In secondary injury prevention, this is early detection and early treatment. This is commonly seen in health screenings such as mammograms and blood pressure monitoring. Also, a secondary preventative measure would be modification of activity. In my example, again, limit playing time, incorporate stretching and eccentric strengthening to help with the symptoms the patient is experiencing at his knee. In tertiary injury prevention, the condition is full-blown and we are simply attempting to stop or slow the progression of this condition. This is most commonly seen in rehabilitation programs of patients that have suffered from a stroke or a cardiac event. Support groups and cleaning wounds are also examples. With patellar tendonitis, some tertiary treatment options would be termination of activity or attempting a corticosteroid injection to reduce inflammation. Now I'm going to discuss how all three of these interact and what happens when they're combined. When we look at combining the disablement model with injury risk factors, we are able to identify risk factors for each stage of the disablement model. Looking at the disablement model and injury prevention, combining these help us implement prevention activities for each stage of the disablement model. And then with injury risk factors and injury prevention, combining these two allows us to focus our prevention activities based on the risk factors. Now combining all three. This leads to an increased health-related quality of life for our patients and allows for identification of risk factors and the appropriate injury prevention activities for each stage of the disablement model. While we may not be able to prevent every injury from occurring, we can influence how the patient progresses through the disablement model.